supposed to be a fourth one?
Sorry?
Wasn't there supposed to be a fourth one person?
Yes, he's a student. We printed these out before. We were able to get confirmation that he's here.
What's staying with you?
Oh.
So we're all.
Is that my
Well, I mean, they have a six year.
I mean,
They still.
yeah, this one is like.
Because I make over
I don't see like crazy.
I'm gonna tell you this for a month. No, I'm sweet. So it's because of, I hear you. What? No, I don't just have to. I don't just drink alcohol.
Hello, everybody. We're going to start in a minute. I just want to make sure that everybody on Zoom can hear me well. All our speakers can hear us. Okay, good. And everybody in YouTube, we have enabled the chat, so you can actually submit your questions on there now. And if you're on Zoom, then you can submit your questions using the Q&A icon. And I want to say a big thank you to everyone who showed up today in person, even though there's a Zoom option. It really is a game changer, so thank you very much. And thank you to Cheryl, because without her, none of this would really be possible. It's been hard not having institutional support, but I'm realizing that we probably don't need it because we have people like Cheryl to protect us and allow us to have these safe spaces that are much needed right now. So thank you so much, Cheryl. And please, a little round of applause. I'm not going to talk too much because we have a panel of really amazing speakers. The first one that I'm going to call on is Ahmed Harzallah. He is a student in Dartmouth right now. He's a freshman, and he's a Palestinian student from Gaza that I have been talking to recently since the atrocities in Gaza started. And I couldn't think of anyone better to do the opening remarks today than him, because it is World Children's Day today, and he actually turned 18 this year. So we want to hear from you. We want to hear your experience growing up as a Palestinian student in Gaza. And please, the floor is yours, Ahmed.
Thank you, Noor. Salam, everyone. I'm Ahmed Harzallah. I go to Dartmouth College, and I'm just taking my space currently just to give you a little sight of how we're actually living in Gaza. Just give you a background before going through into our session. When you're born in Gaza, your path of life is immediately set for you. Imagine being stuck for 18 years of your life in an open-air prison where you're living off restricted resources in an apartheid state with tiny droplets of food, water, and electricity. Imagine being born stuck, having no sense of recourse, nowhere to go, and simply trying to live through the people living tens of kilometers away from you, while they live completely a different life, enjoying fairs, festivals, all while seeing you less than human than them. I left Gaza in hopes of pursuing college and eventually going back to the place that I've always seen as home. I'm more than sure in summer I will have nowhere to go because Gaza will not be the same. Coffee shops are different. Streets that I used to hang out with my friends and have midnight talks with are like they look turned to ashes, basically. Landmarks, buildings, people, like everyone turned to ashes. And each day that I try to reimagine them, but they're like slowly fading from my memory because I'm here instead of being there, and I can never see them again because they're all ashes now. Me personally, I lived through the biggest 4 events in Gaza in 2008, 12, 14, 1921, and 2022. And my heart shatters even more every day that I'm not being able to stand with my family during the current events going now. Everywhere in Gaza, I live with fear and anxiety over my family and our lives. Being 14 to 16 years old Gazan, I didn't know much about the outer world other than happiness. And I wondered why our voices were not even heard, and how we've always seen as just numbers. Those who has died in the current events are not numbers, and neither were those who died in every war in Gaza. And now me, while being away from my family, has made it miserably much more worse for me to cope with wars. And I have always lived hand in hand with my family, sticking together and knowing it's only us and God, and nobody could ever change our destiny but God. I'm thinking about my family before myself, and every time that I say this, my heart aches more and breaks into even more pieces. My family has no internet. They have little resources of water and food, and it has been this way always. They're always given droplets of these basic needs throughout the siege on Gaza. But now it's completely different. It has never been this extreme to cut all resources of water, electricity, and internet and communication. It has never been so extreme that the situation led to displaced people, including my family, getting humiliated while evacuating from the north to the south, witnessing people being hit with missiles in front of their eyes. And I'm not talking about the videos that have been like posting on social media. I'm talking what I've heard from my mama while she was talking to me after they evacuated to Rafah, which is in the extreme south. How they felt extremely miserable and how they felt that they were not humans, that they went into an experience that they felt they're not humans, that how they felt unhuman while evacuating from the north to the south. Sometimes I wish I never traveled to the US, and I wish that I was among my family. Sometimes I wish that I am able to feel their fear, to suffer their sufferings, and to cry with them. And people would ask me how I'm doing. Well, actually, I don't know, and I don't even know how to answer the question that how my family is doing. Although I'm far away from these events, I feel as if I've lived through them, and they changed me entirely and exhaust me permanently. And no one would ever know how it feels to carry the weight of sharing the news with your family every day at 4 a.m. Because basically, your family doesn't have the internet connection to be able to see the news. No one would ever know how bad and miserable it would make you feel when you forget to share the news with your family, and that they had to wait 3 days to evacuate instead of evacuating the same day because you basically forgot to tell them that, Mama, you can evacuate today. A lot of you can evacuate. I was responsible for my family's evacuation 5 days ago. I promised my mama that everything gotta be okay when they evacuate, just because I have the luxury of seeing the news and they don't. I couldn't sleep till I knew that they were safe. Yet the last thing that I knew before sleeping, that they were sleeping in a tent that belonged to the owner, was cold for 2 days. No one would ever know how hard it is to decide to evacuate, leaving your memories, your roots, and basically every bit of your existence behind. And with each step, you just like feel like betrayal, that you just betrayed everything you have. But despite the darkness, let's not forget the hopeful side of Gaza, where it's a place filled with ambition, where people strive for the basic and genuine happy life. Allow me to shine a light on my high school. My high school is called Arafat Secondary School for Gifted. My high school had been actually destroyed or had been affected by the war 2 days ago. My high school has been established in 1988 for students with a GPA above 3.2. It's alumni. Yeah. Noor?
You can continue, Ahmed. I think it's somebody else on the panel. I think you're good, yeah.
Arafat Secondary School alumni have went to the top 10 schools in the US, and they have also produced 2 Rhodes Scholars, and it had inspired a lot of students. I had a life in Gaza beyond war and explosions. I have a family, friends, and relatives currently unreachable due to communication cuts. I have a family whose apartment, despite the challenges, remains kinda-ish. Maybe it's not even remaining. All I've seen videos of my apartment and our building, just been like, it had been like all the buildings near it had been destroyed, and that footage was like a week and a half ago, and they have already destroyed the area multiple times in the past 2 days. I have friends unable to attend college because Israeli occupation forces have attacked and severely damaged most educational institutions in Gaza. Gaza will never be the same for my people, but resilience is the only hope for them. It's not acceptable to get used to such things. It's not acceptable to expecting your home or house and even your future to be affected permanently due to a war. I pray every day that when I come back to Gaza, it feels like home, knowing it will not be the same afterwards after I left Gaza. And finally, I want to express how thankful I am to be Gazan, to be Palestinian. And I'm sure that the love that I had lived in Gaza has shaped me to be the person that I am today. Thank you, everyone.
Thank you, Ahmed. It's hard to imagine what you're going through now, but I hope you know that we are all very proud of you. Proud that you are talking to us today and proud that you are amplifying voices of your family back home and of your friends back home. We're sorry for what's happening, and we're going to do our best to make sure that it stops as soon as possible. And that one day, like you said, you will be reunited in your homeland with your loved ones. Thanks.
Thank you, Noor.
Our next speaker is Dr. Asma Taha, and I'm going to introduce her briefly before showing a video that she asked me to project for you all. Thank you. Let me spotlight her here. There we go. Dr. Asma Taha is the Pediatric Nurse Practitioner Program Director at Oregon Health and Science University. She has been in practice for over 3 decades as a clinician, educator, and scholar, and she has volunteered with Palestinian Children's Relief Fund since 2005 and served on over 20 outreach missions to Gaza and the West Bank. Dr. Taha serves on the Pediatric Critical Care and Pediatric Surgery Advisory Committee for PCRF. Thank you for being with us, Dr. Taha. I'm going to show the video quickly, and then you can take over the mic.
نفتح الباب هذا اصبروا يا شباب نفتح الباب الثاني
لا ما اخذتش لا ما اخذتش اسمي بنت شيماء ابو خالد
Thank you, Noor. Thank you. I'm sorry to share such images with you and the World Day for Children. It's really sad to see what's happening for children in Palestine today more than ever. As Noor said, I have started working with PCRF or volunteering with PCRF since 2005. I am a pediatric nurse who spent a lot of time in pediatric ICU, pediatric cardiovascular ICU, and then in the last almost 20 years, I have done a lot of pediatric neurosurgery. Our outreach to Gaza was focused on the care of children who are born with congenital heart disease, children who basically sustain either traumatic brain injuries or develop brain tumors, and there is no pediatric medical care to take care of those children. The first time I went to Gaza, I was myself scared. I am Palestinian. My parents left in 1948, and all what I knew about Gaza is what you hear on the media. Going to Gaza was an eye-opening for me, like the amount of checkpoints that you have to go through, the amount of security clearance that you have to go through. And then you get to the other side and you work in hospitals with excellent nurses, excellent doctors. It's just, unfortunately, they did not have a specialized training. And why is that? So I'm sure you heard from Ahmed and heard from the other speakers that Gaza have been under siege almost for the last 17 plus years, 18 years. What does that mean? That everything enter Gaza, everything exit Gaza has to be calculated, approved by the security forces in Israel. That means every single piece of food, medicine, supplies have to be approved by Israel in order to enter Gaza. And then people cannot go out and in as they wish. Sometimes your child is diagnosed with a congenital heart disease. You need an open heart surgery that they cannot afford or offer in Gaza. And you want to travel to Egypt or Jordan or even to Israel to do the surgery. But with security clearance, all those parents, mom, dads will fail security clearance, and then they cannot leave Gaza. So as a result, you see your children suffer or even die in front of your eye, and you really can't do anything for them. I'm gonna share a story of a boy. His name is Muhammad. He was 13 years old, and I met him almost 3 years ago. We were on a pediatric neurosurgery outreach trip to Gaza. And this boy, both parents have PhDs. I remember the dad had a PhD in microbiology, and he was one of the faculty at the Islamic University, which was basically totally destroyed in this last invasion in the last couple of weeks. So you have two parents, have PhDs, a child is losing his vision gradually, have a brain tumor that no one could basically handle in Gaza, in the north or the south. BCRF, as long as MSF, had tried to get this child out of the country or out of Gaza in order to get a treatment. And parents were not allowed. Parents were not allowed to leave town. So it's by chance that, a team comes in when you have a child with a brain tumor that you can manage. And basically, the type of a tumor that he had, it was a benign tumor. So if you lift him to be not treated, he'll eventually lose all his vision, slowly. And, when you have an additional mass inside your brain that's not supposed to be there, then pressure will increase and you'll end up herniating and dying. So this is one family story of seeing how your kids can suffer in front of you and you are not able to do anything for them. Another story I want to share with you is when I worked with cardiothoracic surgery, and we have a surgeon from Utah who goes and basically do open heart surgeries on kids. And I can tell you, one of the hardest things I have learned, and I have learned to appreciate about the local nurses and doctors, is the planning that goes in your head that when the electricity goes off, which is the sickest patient that you need to start ambo bagging. I'm not sure if you are first year in medical school or if you have been in medical school for a few years. So if you don't appreciate what I'm saying, I'm happy to explain. But you get kids out of the OR or have not gone to the OR, but they are sick and on a ventilator. And then you get electricity interruption multiple times a day and night. And you as a nurse or as a doctor, you have to think, which kids need me to bag immediately? Which kid cannot tolerate the couple of minutes between the electricity goes off and the local generators comes on, or if they come on? So all this moral distress that healthcare providers face on every single day, nurses, doctors, even housekeepers, it's a draining. So you have a health system that have been strained and have been basically deprived from specialized training to help their own people, to now a health system that is 100% destroyed. We have 19 hospitals so far destroyed. One of them was last night, and many kids were killed in the hospital. I'm not sure if you following the news or you are reading what's being published, but there is a new term that basically coined as a result of what's going on in Gaza now, which is WCNSF, and basically that means wounded child and no surviving family. So as you can see in the video that we just saw, how many kids, those are in the neonatal ICU or the nursery, they're gonna be transferred somewhere else. Many lost their families. They don't have anyone left to take care of them. And those kids, unfortunately, are going to be orphans. God knows how is there a transfer for a very little fragile kid to be transferred from Gaza to even neighboring country that takes several hours to go to Egypt or to Jordan for a treatment. It's very demoralizing for me as a healthcare provider, because I can tell you, I am happy to help anyone who needs help. And we see those kids, we see the families, we see everybody struggle and suffer. And unfortunately, our kids, our future, they are paying the price for all this craziness. That's all for me. I feel I'm gonna have more time for questions, but
Thank you, Dr. Taha. Thank you for your testimony, and thank you for all the work you've been doing with PCRF. We'll be taking on questions during the Q&A portion, so please stick with us. I'm sure you'll have plenty of questions to answer later. Our next speaker is Dr. Tanya Haj Hassan. Dr. Tanya, can I ask you to please turn on your video so I can spotlight you for our audience? Great.
Yeah, sure. Hi.
And 1 second. Okay. Dr. Tanya Haj Hassan is a pediatric intensive care and humanitarian doctor based in Canada and working half the year with Doctors Without Borders. Something that's not written on her bio is that Dr. Harrington last week said that she's a legend. I wanted you to hear that from me too. She's a graduate of medicine at Oxford University and has worked at children's hospitals in the US and Canada since. She has worked in multiple humanitarian settings around the world, including several trips to the West Bank and Gaza for over 10 years. She is also co-founder of Gaza Medic Voices platform, which is a social media platform to share the voices of medical professionals in Gaza during this humanitarian crisis. Thank you, Dr. Tanya, for being with us today. The floor is yours.
Thanks for having me. And I don't know if we can say Happy World Children's Day, but Happy World Children's Day. So many of you might know that today's World Children's Day was created by the United Nations essentially to assert the importance of protecting the rights of children everywhere. The theme this year is For Every Child, Every Right. Unfortunately, this rings very hollow in the wake of the worst humanitarian catastrophe that many of us will have seen in our lifetime, just in terms of the scale on the time period and the kind of catastrophic aggression in which it's happening. Most of you probably know that nearly half of the population in Gaza are children, so over 1 million children. And so it's an incredibly youthful population that has experienced 16 years of siege and collective punishment and multiple indiscriminate bombardments. This is not the first one they would have experienced in their lifetime. Prior to current hostilities, this has also been the deadliest year on record for Palestinian children in the West Bank. And I know my colleague Nassim right after me is going to be speaking more about children there. At least 86 have been killed by Israeli forces and settlers since the beginning of the year. On November 6th, I believe it was, the UN Secretary General Antonio Guterres declared that Gaza is becoming a graveyard for children. That is a statement that's coming essentially from the fact that more children have been killed in Gaza in the last 6 weeks than collective global conflicts annually since 2019. There have been at least 5,000 children whose bodies have been identified, who've been killed, and almost 2,000 who they have not been able to extract their bodies, so they're missing under the rubble, but most of them are presumed to be dead. So that's almost 7,000 children over a period of 40 days, or about 170 children per day. I'm coming to you today as an intensive care doctor, so I thought I'd spend a little bit of time focusing on the injured, resuscitations, the sorts of injuries we see, and then maybe touch a little bit on the experience of medical providers in Gaza treating them. So when I was introduced, they mentioned that I helped found something called Medic Voices. I was supposed to be in Gaza from November 4th to November 12th of this year teaching, but obviously that was canceled. However, the doctors that I have taught over the years and who I've developed close relationship with have, we've stayed in contact, as have my colleagues like Dr. Richard Harrington and Dr. Debbie Harrington, who spoke with you last week. So what we had decided to do at the beginning of the conflict is try and amplify their voices by quoting them anonymously and sharing them on a social media platform called Medic Voices. So I was trying to think about how to present things to you today. And I've been on call for about 9 days into today, so I didn't have a lot of time to prepare a PowerPoint, but I think it's going to work to everybody's advantage, because what I've done is I have structured what I'm going to say today around the words that have been shared to me from medical provider, or shared with us from medical providers in Gaza, who really should be the ones sharing their voice right now, and unfortunately are stripped of that ability in the setting of the atrocities. So I'm going to go ahead and share my screen. One second. Can somebody enable screen sharing for me, please?
Yes. You should be able to do it now.
Thank you. Please, 1 second. Hopefully this works. Okay, please don't judge my desktop. It's been a week. Okay, good. So, can you all see my screen?
Yes.
Okay, perfect. So, the group that teaches with me in the Gaza Strip have essentially, since the aggression started, have tried to be the voice to the outside world of medical providers there. And that's what I'm going to try and do today. You'll see, obviously, we know that there have been a lot of communication difficulties that have prevented medical providers in Gaza from communicating with the outside world and with journalists. But one of the other main limitations is the fact that they are so overwhelmed caring for the victims of the conflict, as this Dr. El-Shifa said to us almost more than a month ago now, that he would try and share some of what is happening if the river of innocent victims and children stops flowing towards the hospital. So I think the first thing to talk about when we talk about these sorts of mass aggressions is mass casualties, and what that looks like for a physician in an emergency department who is trying to triage. This is an emergency medicine doctor that I know at El-Shifa Hospital, who said, and this is again very early on, that they'd received more than 700 casualties at the same time in over 25 minutes. There's no space. They're dealing with patients on the floor. There are no beds. So you can imagine what trying to resuscitate 700 patients looks like with limited space. And this was early on. So at the time they had electricity, IV fluids, and pain control. But obviously that's very different right now, as these stocks have run out. We're taught, as you are probably being taught right now, how to deal with mass casualties. We have WHO protocols. We have protocols from the various societies of critical care and emergency medicine, but there's no protocol that prepares you for this. And one of the doctors said that one day when we were speaking. He said, there's no WHO protocol that prepares you to deal with this kind of mass casualty. And it's not just the medical aspect that you're dealing with. I don't know if any of you have ever been in a mass casualty, or even like a mass trauma, a bad car accident where multiple victims come in at once. Very difficult images to be looking at, very disturbing even for a doctor who's trained to care for such trauma. I know for myself, I'm a critical care doctor, so I am trained to respond to level 1 traumas. But the videos that are coming out of Gaza are very difficult for me to watch. Me and many colleagues who work in emergency and critical care medicine have described feeling faint, nauseous, just looking at some of the pictures. So you can imagine what being like there that is like, trying to provide emotional support for the patient, for the family, and trying not to be overwhelmed so that you can continue to do your job. You also have to make a lot of decisions about triage, which patients get care and which don't. If you have 5 children arriving at the same time, one of them very visibly agonal breathing and likely dying, one hemorrhaging to death and needing emergent resuscitation to prevent arrest, and maybe a third one with an awful fracture who is screaming out in pain, a fourth one with 60% burns who also needs fluid resuscitation and pain control. And you are 2 medical providers and you have to decide very quickly, who do you get IV access in first? Who do you try and treat it immediately? Are you trying to relieve the suffering of the one that's dying? Are you trying to relieve the pain of the one who's not going to die, but or unlikely to die and likely to survive, but in excruciating, inhumane pain? Or are you trying to resuscitate the one immediately that you could save? And I think those decisions are very difficult in the moment. And we have training that helps us deal with making those sort of triage decisions, but not when you're receiving 700 casualties at once. The sorts of injuries that they're seeing are really horrific, as you know, described here as beyond imagination by a surgeon at the Indonesian hospital. If you guys are watching the news today, that was the hospital that was hit today and is being held under siege. So I'm going to go through some of these injuries because I know we don't get a lot of experience with them in these sorts of secure, safe settings like the United States and Canada. So blast injury is one of the primary injuries that you're going to see with aerial bombardment. And blast injuries are complex and multifaceted and involve multiple organs. They're very highly demanding traumas, and I'll go through why. The data is difficult, but the mortality is highest in younger children and male. I'm not sure why male in particular, but for younger children, it's thought to be partially due to the fact that they're quite close to the ground. So vital organs like their head are very close to the ground because they're small. And yeah, and then obviously because I think their organs are quite small, close together. So talk a little bit about blast injuries. There's primary, secondary, tertiary, quaternary, and quinary blast injuries. So a primary blast injury is essentially the injury that results from the very strong shock wave itself, like you may have seen in the Beirut explosion last year. Secondary blast injuries result from fragments, and this is usually the highest cause of mortality. So the various things that explode and penetrate individuals after the blast. Tertiary blast injuries result from bodily displacement as the body hits into something or gets crushed by something. So this includes crush injuries. Quaternary blast injuries are from other explosive events, including burns and inhalational injuries and toxins. And quinary blast injuries are the environmental contaminants that rest after the explosion itself. So you may have seen a lot of people complaining about being unable to breathe, feeling like they're suffocating in the days after heavy bombardment. Particularly with primary and secondary blast injuries, you have a lot of hollow organ damage. So pulmonary contusions, lung contusions, pulmonary hemorrhage, sometimes air embolisms, a lot of traumatic brain injury, and things that might not be evident. So you may have seen in some of the videos, and I'm sorry, I know you're all medical, but or at least some of the people, at least in the Harvard audience, are medical. So I'm sorry for people who weren't expecting to be exposed to graphic detail. But you've seen a lot of the children being brought in who are quite limp or unconscious, and they don't look like they're badly injured on the outside. But then somebody feels their pulse and says that they have passed away, or they try and resuscitate them and they don't manage. A lot of that will be as a consequence of these sort of internal injuries that I'm talking about. So traumatic brain injury, pulmonary contusions, cardiac contusions. Crush injuries, I mentioned, are part of the tertiary blast injuries. You've heard a lot of people describe children being trapped under the rubble, or adults and children being trapped under the rubble. one of the emergency doctors that used to be a medical student that I taught described essentially asking every patient that comes in, how long were you trapped under the rubble, or how long was this child trapped under the rubble? And the reason that's important is because when you're trapped under that kind of pressure for a long time, and don't worry about the details of this figure, it's a very bad presentation technique for me to include so many details in a slide. So it's not that relevant. It's just to say that when you're crushed like that, your sarcolemma membranes of your muscles start leaking various things. Sodium, calcium, and water leak into the sarcoplasm, and then potassium, myoglobin, phosphate, and urate leak into the circulation. The importance of that is multiple effects, including acute renal failure, hyperkalemia, metabolic acidosis, hypocalcemia, compartment syndrome requiring fasciotomies, and shock. These are very complex problems, not very evident when the child comes in. You're celebrating the fact that you're able to extract somebody from under the rubble alive, and then you have to deal with the kidney failure that they go into thereafter. And when you don't have enough dialysis, you don't have electricity, you don't have the solutes needed to run dialysis machines, you can't dialyze these patients. Compartment syndrome, you need fasciotomies. Again, early on, the operating theaters were full and overwhelmed, doing a lot of fasciotomies, amputations, various procedures. But now with so much of the healthcare system, I think 27 hospitals that are completely non-functional and 9 that are partially functional. You can imagine how difficult treating these injuries is. Burns, severe burns, colleagues have described to be children that are, have minor burns that can be managed more straightforwardly, but for the most part, what they're seeing are 30, 40, 50, 60, and then even 70 to 90% total body surface area burns. Over the course of this past week, I've cared for a few burns in a high resource setting, and I can tell you that they are extremely resource consuming. When you have a child who's burnt, at 40, 50, 60%, 70%, they may survive, but they survive with very intense therapies. They're often intubated, ventilated, heavily sedated for pain control, and basically for humane reasons, they're heavily sedated and kept essentially in a medically induced coma to prevent them from experiencing the severe pain associated with these burns. They also lose their protective skin membrane, so they lose a lot of fluid, a lot of electrolytes. Managing those things is very tricky. You're taking regular labs, you're giving them a lot of IV fluids, of which we know that most hospitals in Gaza are running out. You're measuring their potassium, their sodium, their calcium, all of their electrolytes very frequently. You're also keeping them warm because they can't keep themselves warm anymore. And you're managing their dressing changes regularly. Dressing changes are extremely painful. So they have to be deeply sedated and analgesed for those procedures. They also have to be done under sterile conditions as possible because they've lost the protective skin barrier, and so they're at a high risk of infections. All of these things are going to be impossible in a setting where you have, hospitals are operating at 400% capacity. They've run out of antibiotics. They can't do regular testing. They've run out of IV fluids. They don't have electricity for ventilators. These kids often also get fluid overloaded as you fluid resuscitate them and end up with pulmonary edema and requiring higher ventilatory settings to maintain their oxygenation and ventilation. So extremely difficult injuries to take care of which they're seeing thousands in the Gaza Strip. Shrapnel injuries, I mentioned in the sort of secondary blast injuries, you get shrapnel and other things kind of exploding and penetrating. This was a message yesterday from an emergency doctor that had fled Al-Shifa, saying that the last patient he received had shrapnel essentially all over his body. Very difficult injuries to manage, require surgical treatment, and I'll just leave it at that. Amputations, I'm sure you've heard a lot from Dr. Ghassan Abu Sitta and other people who've been vocal in the Gaza Strip about managing these, but they're really difficult to manage as well, require a lot of surgeries. I forgot to mention with regards to burns, but it applies for burns and amputations. They often require, multiple debridements and trips to the operating room multiple times. So it's not just that you come in, you resuscitate them, and then you're done. Their wounds often get infected. We know that hospitals in the Gaza Strip have run out of antibiotics, are using vinegar and hypertonic saline, amongst other things, to try and disinfect wounds. That some of the wounds are being infected with maggots. So really like a grim situation when it comes to caring for a lot of these wounds. And then there's the psychological trauma of having a child come in badly wounded and absolutely terrified. My colleague before me from PCRF mentioned these children that come in as the only survivor of their family. This is a very frequent message we've gotten from physicians in Gaza. They have children in the ICU who are unknown, don't have family visiting. We don't know if the family survived. They are unlikely to have survived, or perhaps are elsewhere in the hospital and critically unwell. A lot of them cannot be identified, and so are marked with the words unknown and a number associated with that. This says majhul in Arabic, which means unknown. And then there's the psychological trauma associated.
Dr. Tanya?
Yeah.
I hate to interrupt, but we're going to try to leave some time for our next speaker in the Q&A portion, but we would love it if you could send us the slides, and I will share them with the people who register for the webinar and the audience. But thank you very much for sharing and for amplifying the voices of those who can't be with us today. And thank you for founding the Gaza Medic Voices, because that's been a huge way for healthcare workers who are not in Gaza to understand what it means to actually serve in a no resource setting. So thank you very much for all you've done over the past years, but especially for being vocal. I know it probably isn't easy to be vocal where you are. So thank you so much. Our next speaker, thank you.
I'm just going to end with this one slide.
Yeah, please.
It's really important that we keep speaking out. I know medical providers in the Gaza Strip feel very isolated. And as a healthcare community, I think we have to come together globally to support each other when these sorts of things happen, and other healthcare providers elsewhere in the world are deprived of all the tools of modern medicine to care for their patients. So I appreciate everybody who's doing what they can to speak out for this and to call for a ceasefire.
Thank you, Dr. Hassan. Our next speaker will be talking about the escalating violence in the West Bank. Our next speaker's name is Dr. Nassim Suleiman. He's a pediatric critical care attending from Chicago with a background in international health and medical mission experience in Latin America and the Middle East. He's currently serving on the medical advisory board for PCRF, Pediatric Critical Care Team, and has recently visited the occupied territories of Palestine, where a lot of his family resides. And I will put a spotlight on you. Just one moment. There we go. Thank you, Dr. Suleiman, for being with us.
Hi, everyone. Thank you for having me. I do want to thank Dr. Asma and Dr. Tanya Haj Hassan as well for covering the situation in Gaza as well as you guys did. It was very great. I'm going to just talk briefly about the West Bank so we can kind of get into the question and answer part. So just a little background for the West Bank. Palestine is divided into these three unconnected and non-contiguous regions: the West Bank, East Jerusalem, and Gaza. And then the West Bank specifically is further divided into small enclaves by the separation wall, checkpoints, settlements, blockades, refugee camps. There's very little freedom of movement. Prior to the incursion, there was a count of over 600 different blockades. The Israeli military controls the movement of patients, doctors, ambulances, and medications in and out of the area. They actually can say who goes to work, at any particular day if they want, and who doesn't. In just brief history, 1993, the peace accord gave the responsibility of the healthcare in the territories to the Ministry of Health and the Palestinian Authority. However, Israel retains ultimate control over all the healthcare budgets, border crossings, building permits, pharmaceutical imports and exports. I was tasked with, through PCRF, I was tasked with doing assessments on the pediatric services that they have, specifically the pediatric ICUs, but I also took a look at the general pediatric wards and the NICUs as well, the neonatal intensive care units. The Ministry of Health hospitals are very basic, certainly compared to any hospitals here or in Israel. They lack many resources, especially in regards to subspecialists, specialty medications, imaging, diagnostic tools that they just really don't have. And a lot of people will end up, eventually coming into these hospitals, but they come pretty late in their disease process for very serious ailments, only to figure out that the required testing and procedures are either unavailable or unaffordable for them. The doctors there, that I had worked with, there's very little opportunity for training. There's no, continuing medical education, no opportunities for professional development. There's, I think, 8 times less specialists than there are in Israel. The public hospitals, they do not provide any cancer treatment whatsoever. So, you either have to transfer to a private hospital or go abroad. So I have family members that have had to go to Jordan because they weren't allowed to go into to Israel or Jerusalem for treatment. And so they have to kind of go back and forth, and it's just rather difficult. And West Bank Palestinians cannot go to Israel without the actual permit. So, and most males will get denied on the pretense of security. There is a little bit better facilities in East Jerusalem than there is in the rest of the West Bank, and for sure better than in Gaza as well. So there's a checkpoint they call the Zaytun checkpoint. There are a couple different names for it, but this is one that goes into East Jerusalem, and it can only be accessed or crossed by foot. So, if you're ill and, dying of cancer, or, just can't really, you're not very mobile, it's that much more difficult for you. The separation wall obviously is a major barrier to healthcare as well. Not only does it cut into the Palestinian land, but it creates barriers through all different parts of the West Bank, so that literally you can't get to the next village over, which could usually be a 5-minute drive. You might have to travel, if you're allowed to travel, you could travel maybe, a good hour and a half to get to the same place. The Palestinian Red Crescent Society, they are under constant attack as well. There's 3 types of forms of violations that they describe. One is preventing the actual help, the personnel, the medical personnel, from accessing the emergency services. So this just happened the other day. There were 7 that were killed in Jenin, and they would not allow, and there were others that were injured as well. They would not allow the personnel to enter the city to evacuate. There's also direct attacking of the ambulances, even with live ammunition. Or there have been physical attacks, beating, shootings, and tear gases of the emergency medical personnel. Last year alone, they documented 380 violations against emergency medical services, including even removing wounded passengers in the ambulances and arresting them after they had been shot for suspected of throwing stones or whatever. So specifically talking about the ICUs, there are no pediatric ICUs in the southern West Bank. This is like the Hebron area. It's the largest city in all of Palestine, except for Gaza. I'm talking about just specifically the West Bank. And there are no pediatric ICUs at all in any of the government hospitals. The private hospitals they're all pretty subpar when it comes to pediatric ICU. They might have a bed or 2 dedicated to the pediatric ICU patients. But most of them, just as in the public sector, they want to transfer these kids out to either Israel or anybody, any bigger center that's willing to take them. Transfers are not often accepted. Patients end up staying for much longer than they should be there. So they end up getting treated by just general pediatricians with the aid of sometimes the adult ICU doctor who's there. But every time I would go to these hospitals, there would be pediatric patients that were just waiting and being as managed as best as possible with the help that they had. But they were there for days, sometimes weeks, waiting on a transfer to a proper tertiary care center. The general pediatric ward was just overburdened. I remember there were 4 nurses and there were over 50 patients, pediatric patients. I also visited the NICU at Alia Hospital. Its capacity is like 30 some beds for NICU patients. They only had 6 monitors to keep on their babies, so they would kind of save those for the babies that were intubated. Also, they did not have the proper NG size, so they weren't feeding any of these infants, which is kind of crazy because they didn't have central lines either. So they were not able to get nutrition to a preterm baby that is essentially just getting dextrose through an IV. And so these kids do not do well, and they tend to their survival rate is much lower. And obviously, when they have no nutrition, it's going to affect them severely. There is one hospital for pediatric cancer patients in all of the West Bank, and that one does not have a pediatric ICU either. That is something that we're kind of working on. So just since this second week of October, I just real quick and then I'm done. There have been over 200 Palestinians that have been killed in the West Bank by settlers or the army / police, and not one has been held accountable for anything. There are a lot more delays in healthcare because of this new the settler violence and the increase in this. So people will show up sicker. They're not getting dialysis as they're supposed to. They're not getting their medications. They're not showing up to the hospital until they absolutely have to. So they're coming very late in the disease process because there are these groups of settlers that will congregate in areas where, like traffic circles where they have to slow down so that they can see if the car has Palestinian plates, or if there are Palestinians in the car, then they will often get attacked. And they're kind of in berserk mode right now. I mean, this has been previously there have been attacks, but it's unprecedented what's actually happening in the West Bank right now as well. There's also issues with drugs coming in from Ramallah and Nablus. There's an area called the Container, which is a checkpoint that drugs come from the north to the south, and that has been closed for since the beginning. They're opening it just for hours at a time and not allowing a lot of the drugs to come back in as they come into the south as they normally would. All the ministries are not paying their workers, so this has gone on for 56 days. So all the hospital workers have not gotten paid for 56 days. So this is even prior to the recent incursion. But they say that the funds are reportedly being withheld by Israel. But I'm sure that's in conjunction with the PA as well. I'm not sure who's to blame there. But people are also working longer shifts because of the settler violence. So they're scared to travel. So I have a brother-in-law who's working literally 24-hour shifts because he does not want to come and go and risk his life as little as possible, essentially, as he can travel. And I think that's kind of all I had to say. The preventative care is not really it's non-existent over there for most people. It's really a luxury for those who are able to who have money and can see a lot of the private subspecialists if and when they're there. But yeah, I think that's kind of what I have to say about the West Bank. Sorry, I didn't leave too much time for questions, but hopefully we can.
Perfect. Thank you so much, Dr. Slimane. So this is Iman Ansari. We'll try to get you all on the same screen. I'll introduce myself to the audience. Some of you have met me in the prior sessions. So I am a Palestinian American. I am a pediatric pulmonologist, intensive care unit physician, and I work in the emergency department as well. I lead the Pediatric Critical Care committee for PCRF. So I'm also part of the medical advisory board, and I work directly with Dr. Slimane and Dr. Taha. And I would like to introduce you as well to Dr. Sharon Norman, who joined us, and she's in the screen down there. She's also a pediatric nurse practitioner who works in Oregon with Dr. Taha. They're both PhDs, so they're both doctors. So we have all four doctors on the screen. I'll just start by thanking all of you for what you do. And Ahmed, hi Ahmed, you are the same age as my children, and I'm so grateful for your courage to come and speak with us today. And I'm like you, I'm very proud and I feel very lucky to be a Palestinian. So thank you for saying that. Ahmed, when I started going to Palestine on medical missions, I wanted, my goal was, I wanted to bring the same level of healthcare that my children have here to the children of Palestine. And I found exactly what Dr. Sliman, Dr. Taha, Dr. Hassan, and Dr. Norman would share with us and have shared already, that the level is definitely not like the US. And talking about resilience, like I've met impressive nurses and physicians who can do with very little, but it seems like right now they will need to do with almost nothing, right? That is the status of the situation in Gaza. The first question I have for you, and I think most people here would share it with me, how do you think we can help them over there now, and once we are able to go on the ground or get supplies on the ground to Gaza? Who would like to take that question?
I can start if you like.
Please.
So I think our voices matter big time in the US, and we are privileged to be living in a safe environment and far from all this unrest. I think using our voices and using our influence to advocate for a ceasefire, that is the most important thing we need to get right now. Because if we don't have a ceasefire, that means that this killing machine is going to continue. So life is sacred in all religions and all humanity. So let's focus on that. Let's use our voices by all means. If you are on a social media, if you can advocate to your senators, congressmen, women, the presidents, we really need to keep a pressing in there. That's what I'm doing. This is what my community is doing right now.
Thank
Till
you,
we are
Dr.
able
Taha.
to travel.
Yeah. And there are ways to sign up and volunteer even during medical school to MSF, I believe, Dr. Hassan, in addition to PCRF. And if you're interested, just let me know. There are forms that you can fill, and you can see which type of a role you would be interested in doing. And in addition to other organizations, I'm sure Red Cross and Red Crescent have also avenues for you to pursue. Dr. Hassan, it seems like you wanted to say something as well.
I probably just an answer to the question. I want to echo what Ghassan Abu Sitta said a couple of weeks ago when he had a webinar from Gaza, and he talked about thinking about next phases too. Because right now, I think a lot of us are energized by grief, rage. You know, we're all channeling our emotions into different types of action. But when the violence dies down eventually, you're going to be left with a civilian population who is displaced with no infrastructure that's essentially the infrastructure that's needed for life, be it homes, schools, clinics, hospitals, facilities for water desalination. And so I think if we channel some of the energy that we have right now, yes, into calling for a ceasefire, but also into mobilizing efforts for the rebuilding and the support of the population when all of this, when the dust has settled, we might actually be able to continue sustaining the support, this amazing support that we've seen from the global community this past 6 weeks.
And we anticipate that the need will continue, even though maybe the immediate trauma is will stop. the post-trauma and the infections that will happen afterwards, the sanitation that doesn't exist, a lot of things will result in diseases that we will need to attend to in the ICU and elsewhere. Right?
Well, there is going to be no ICU.
Yeah.
I think that's part of the problem. There's going to be no infrastructure. I can even speak for colleagues of mine who are relatively well off, comfortable with a home, a family, who are currently today, as we're speaking, sending me messages today saying that they are homeless and trying to find a tent for tonight in Rafah. So it's an absolute destruction of all infrastructure necessary for life. And since we're on Global Children's Day today, infrastructure necessary to protect children, be it shelters, schools. I think I read today that 1 in 9 or 1 in 10 classrooms only 1 in 10 classrooms in the Gaza Strip have not been destroyed. Something to that effect. Don't quote me on that. Look it up first. But essentially, all the infrastructure that's necessary to protect and support children has essentially been destroyed. So all of that's going to need to be rebuilt.
Thank you. Questions from the audience? Do you have questions online, Noor?
How can we volunteer on the ground?
Yeah, more questions about volunteering on the ground in Gaza. I think right now, my understanding is that no one is able to go in. I don't know, from the PCRF, we know that we haven't been able to go in. I don't know if in MSF, if anyone was able to go in, unless they were already inside.
Yeah, there was a team that crossed last week. They're in the south. It was the first team that's gone in since the aggression started, but it is incredibly difficult to get in. It's a lot of negotiations that happen with various stakeholders at the Egyptian border, including Israeli stakeholders. And so it's extremely difficult to get in. But yeah, how can you get in right now? It's virtually impossible. But I think the most important thing right now is just to advocate to stop the violence.
There's a question on the
YouTube
stream about Rafah and why is it not open? Why is the crossing not open for humanitarian aid?
Thank you. So Rafah, why is the crossing not open for humanitarian aid?
Those crossings are controlled by government. So it's controlled by the Israeli government and it's controlled by the Egyptian government. So you have double control on that crossing. So you have to get the permission of the two governments to get in or get out. So I think this morning the Jordanian have started a field hospitals in the south, and they kind of mobilized some healthcare teams, but this is all governmental people, who goes in and out. But the answer is not simple. Like, those governments have a reason behind controlling people. Like, I think the Egyptians did not want a flood of refugees to be in Egypt because they have seen what happened in 1948 and the influx of Palestinians all over the Middle East. And then we had the recent war in Syria, where Syrians have been displaced all over the Middle East and all over Europe. So opening borders is very complex situation, but governments usually, and not one government, governments control who's in, who's out.
Would you like to elaborate? Anyone can assist. I don't want to put you on the spot, Dr. Taha, but would you like to elaborate what's a field hospital? Because we've discussed that the entire healthcare system and the buildings collapsed. So what is a field hospital like the one that Jordan is contributing to right now? Go ahead, Dr. Taha.
Do you want to go, Tanya, or no?
No, I'm happy to go if nobody else wants to or can answer the question, but go ahead. It's
a temporary hospital, so they bring it in like tents, basically. Tents that they have medical supplies, they deploy teams from the country. Most of them work for the army or the armed forces, and basically they'll bring supplies, surgeons, nurses, to take care of people, but they are not working on any permanent structures. We have seen this even during COVID. We could not admit so many people to the hospital, so we had to put temporarily tents outside of hospitals to accommodate people. We do that in earthquake drills. If you are in an earthquake zone, But it's a temporarily structure that can help provide healthcare for people who are injured. They have ORs, they can deploy all kind of things, but it's all temporary structure.
Thinking about the pyramid of health, so intensive care, what we all do in the ICU is really at the top of that pyramid of care. It's the sickest of the sickest. It's a small number of patients compared to the rest of the population. And now with the mass casualty and the enormous number of sick children that we expect to continue to multiply, as I said, not only from trauma, from diseases, would you anticipate that the focus initially would be on the bottom of the pyramid before we start doing ICU care, or would you anticipate that there will be some ICU care?
I mean, I went into medicine at a later stage in life. I studied global health to start with because I did believe that actually dealing with the bottom of the pyramid saves the most lives. So prevention, shelter, education, clean water, food, sanitation. I still believe that. I think I just enjoy my job and like the clinical medicine of things. But I do think the majority of lives in general, I'm not talking about war times, but in general, you can make the biggest impact by creating a society in which people are protected and have access to the basic rights. All of that has now been dismantled in the Gaza Strip. So we have to start from scratch. That's not going to change the fact that hundreds of thousands of children are going to need, and adults are going to need intensive care, because when they don't have access to water, they develop clean water, they develop, epidemics of cholera and other diseases, and they get very sick and they need to be admitted to hospital and they need aggressive intensive care support. So all levels of the pyramid are always needed, but in the post-war setting, that bottom level is completely destroyed. And so the amount of resources, human, financial, material that are going to need to be invested to rebuild that bottom part of the pyramid is going to be unprecedented.
Thank you. Yes, please.
Just throwing back to prior to the current attacks, I think Dr. Sulaiman and Dr. Sulaiman mentioned something about the ICU in Gaza and the West Bank, and then Dr. Taha mentioned something about children with congenital heart disease. Prior to this, how were children with congenital heart disease diagnosed? Were they capable of prenatal diagnoses? Were they capable of transporting mothers outside to get induced, deliver somewhere else where the children can get immediate care to either cardiac ICU or immediate congenital heart surgery? I ask because I'm in the field, and so I'm interested in knowing.
I can tell you they are very capable of diagnosing. Actually, we were in Maine, the West Bank, doing a cardiology mission, and every single diagnosis was right on the mark. The problem is we do not have pediatric cardiothoracic surgeons who's trained to take care of those congenital heart problems. If you're doing heart surgery, adults have different issues than children. So, some of the local adult physicians or surgeons will do some surgeries, but they don't have the trainings. And part of the reason why they don't have the training is because they are not allowed to exit their country or to exit Gaza to go somewhere else for specialized training. But, we have built valve here in the US, took it with us based on the diagnosis, and we're right on target. Like, we did not waste one single equipment when we went to the West Bank. Same thing with Gaza. We have excellent talent between doctors, nurses, etc. Unfortunately, they don't have the full capacity to run a full team and to do complicated surgeries. Don't know if I answered your question or not.
Yeah, although I have to say one of our discoveries was not all diseases can be treated for Palestinians. So hypoplastic left heart syndrome they do not treat it because they can't do the follow-up. So even if you do the surgery, you cannot do the follow-up with all the checkpoints and the limitations, etc. So that's one of the diseases that are considered lethal for Palestinian children, even though here in the US, it's treatable. And that actually brings me to Dr. Norman. So Dr. Norman, Dr. Taha, and I went to Ramallah last year in September, I think we were there together, because PCRF built like a $7 million pediatric ICU and pediatric cardiac ICU, staffed it with state-of-the-art, the same level of resources that we would have here in the US. It opened in March, but the limitations are, mobility, getting the patients there on time. As you know, cardiac patients, minutes can make a difference in their survival. And I'll give it to Dr. Norman, if you would like to tell us a little bit about the ICUs in Ramallah, because that's the biggest ICU in the entire West Bank, right?
I believe so, yeah. So they actually have two on different levels. So the one that we built that PCR funded is on the 4th floor. It has separate areas for those with cardiac surgery, for cardiac cath, that has rooms that are really state of the art, that I would say has all the same, if you want to say, equipment that we have available here. We set it up actually also for an OR to be able to do cardiac surgery as well. There are the nurses there that have gone and received specialized training in order to actually care then for those patients after cardiac surgery. So there's quite a bit of, I don't know if I want to say emphasis, but support. And the nurses there and the physicians are very engaged, very passionate about caring for these children after surgery, and have gone above and beyond to really provide that same level of care, along with certainly the services and the support that PCRF has made to the hospital in Ramallah. So yeah, 8 beds and then 4 beds that are separate for those that need to stay for a longer period of time.
Yeah, cardiology beds. But so far they've been operated only under medical missions, because to operate it year round, which is the goal of PCRF, capacity building rather than just mission work, you need resources. You need ongoing resources, ongoing medications, easy mobility, all of which are restricted significantly. Yes, Noor.
An important question.
Please.
What types of action are physicians and medical students ethically and morally obliged to take at this time?
Excellent question. So the question is, what type of actions ethically and medically the medical students and the physicians are obligated to take at this time? How do we speak up on World Children's Day and uphold our Hippocratic oath? Who would like to take that? Dr. Slimane.
Yeah, I can start briefly. Yeah, so I think to understand what's kind of going on, I think we have to know that there are 2 wars going on. One is this physical bombardment, the casualties on in Gaza and all of the onslaught that's going on. But then there's this war of like propaganda, and I think that's in the West Bank right now, what they'll do is the Israeli military, they'll come to somebody, they'll ask them to open their phones, to unlock their phones. And they will look at their post to see if anybody has posted anything in favor of Gaza, or if there's likes or whatever it is, and they will literally they're arresting people for this. And they're also doing that to some Israeli citizens as well. I've seen that as well. So I think that's for people, if we kind of back up and try to understand that, I mean, it's kind of showing how powerful that can be. And I think it speaks volumes when you're having to arrest somebody for a post. or for something that they're saying in support of, life, essentially. So I think that that's definitely responsibility. And the other thing too is something when I do a lot of my mission work and I go with medical students or residents, something that I like to kind of bring home when I'm doing these missions is the fact that a lot of what is caused, the root cause of a lot of these issues is our foreign policy. The things that we're doing, our country's doing actively behind the scenes, that then create the environment for these areas to be in such to be impoverished or in war or whatever it is. So I kind of let them know that this is not just pat yourself on the back, you're doing great work, but there's also an element of responsibility that we should take from that, because it is our own tax dollars, our own lack of understanding that is contributing to this, and this is just an exacerbation right now of just apathy and no one doing anything for so long, and it accumulates, and this is kind of the result of that. So I think the constant educating that we're doing. I have colleagues that had no idea. I'm Palestinian. They always kind of knew, in background information, but never really understood. And now they're really trying to understand what's going on because they feel a sense of moral responsibility because it is, we are supporting it. Our country is supporting that. So I think that's definitely a way that we can attack this and kind of deal with that second war that's going on. And just the assault on school campuses, that all this flack that we're catching just for saying being advocating for children's lives. It's something that I think we have to pay attention to and continue in that work. So I'm sorry if anybody else has anything to say to that too.
Thank you, Dr. Slimane. Well said.
I was going to just answer to, it's a difficult question, right? Because we don't really have an actual responsibility. It's not in your job description wherever you work for you to advocate for what's happening in a country on the other side of the world. But I guess from a moral standpoint, we take the Hippocratic Oath and we work to preserve life, to relieve suffering. And I think as part of that, we in some ways maintain a moral high ground in these sorts of situations. And I think that's very important because I've seen a lot of, justifications for attacking a healthcare system or for depriving patients of their needs. And I think regardless of your political opinions, there are very clear lines that you don't cross. Regardless of how you see the history of this, there are very clear lines that you don't cross that have been crossed. And I think we have a moral responsibility to stand up with our profession and to advocate that our profession be protected under these circumstances. Then there's all the other components, advocating for children if you're a pediatrician and you're seeing the catastrophic impact that this is having on the lives of children, for example. But I think just on the topic of the moral high ground, a friend of mine, a doctor with Doctors Without Borders today sent this message. He said, it bears repeating, a patient is a patient. That's what impartiality means. It's based on shared humanity. We are all born free and equal in dignity and rights. That includes the right to health. If you need a doctor, you get a doctor. Simple. This means, and he's referring to the patients, soldier, terrorist, hostage, Christian, Muslim, Jew, Israeli, Palestinian, man, woman, child. It doesn't matter. If you need a doctor, you get a doctor. Healthcare doesn't have an enemy. The doctor of your enemy is not your enemy. And I think that's an important point to make because I feel like we're constantly having to justify various attacks on the healthcare system that have been framed in the context of war and political motivations. It's irrelevant. A hospital is a hospital, a physician's a physician, a patient's a patient. It's irrelevant. These are protected things under international law. And so I think maintaining that moral high ground, not feeling shaken when people try and question it, international humanitarian law, and if you don't, look it up, and stay that moral high ground. I think that's very important in this because there's been so much stooping to like a new low And we need to always make sure that we maintain that moral high ground, and that with whatever we do, we don't spew hate, because that also applies to how we function here as practitioners. I've received numerous very aggressive messages and death threats from people, some of whom are physicians in North America. And I think, you know, if a physician in North America feels that way about me or anybody else advocating for this, how are they going to care for a patient that comes from the same background as these people that they claim to hate? And I think we have to be very conscious of our own selves as well, as we feel the rage, we feel the emotion associated with this deep, deep injustice. Remember that as a physician, your patient is a patient regardless of their background, and their ethnicity and everything else, and make sure that we don't convert any of our anger into hate, and that we maintain the moral high ground.
Absolutely. One of the things that actually I've been repeating over and over again is that I mourn the deaths on the Israeli side. I am worried about the kidnapped Israelis, the children in the kidnapped Israelis. We are physicians, we are humanitarians. We care about the humanity, the dignity, the health of everyone. Absolutely. Well said, Dr. Haj Hassan.
Yeah, I would agree. Actually,
Yeah.
that is very well said. It doesn't matter. We're here to care for all ill children. Yeah, so we need a ceasefire, and we need to be able to go and rebuild and get the base, I mean, the foundation, before we could probably really do ICU care.
Thank you. Ahmed, you've been wonderful and much better behaved than my kids, sitting there quiet while we're talking about all the medical stuff. Do you have siblings, Ahmed?
Yeah, I do. I have one older brother. His name is Bashar. He graduated from college this year. He graduated from Islamic University in Gaza, which has been destroyed. And I have my younger sibling, who's Muhammad. He's 14 years old.
Bashar, Ahmed, and Muhammad, mashallah. And Bashar and Muhammad are in Gaza, both of them right now?
Yeah, they're with my family in Rafah.
In Rafah. And how are they doing?
Alhamdulillah, they're doing okay. I was able to supply them with a lot of eSIMs, alhamdulillah, to be able to contact them. I'm genuinely happy, and I'm proud that I was able to also help them during these times. And I'm really, really wishing. I've been like seeing a lot of some people like sharing about they're like might be a ceasefire and stuff, and I really wish for a ceasefire currently, because both sides like had been done with the ongoing war, ongoing events, and the least thing that I can wish for and everyone can wish for is a ceasefire, basically.
Inshallah. And Ahmed, I hope you get to tell them that we are thinking about them, and we're doing this event talking about them, and many, many other events. One of the things that were surprising to me when I started going to Palestine was meeting people and having them ask me, you still remember us? Do you still remember us? Please don't forget us. And they keep repeating that even before this war. There is a worry that somehow we've forgotten about you, and we haven't. And I hope you can tell them, and they can spread the word that they're on our minds and in our hearts, and we're thinking about them.
I will, and really thank you for like sharing our voice and the voice of Gaza and Palestinians.
Thank you. Any other questions?
Yes, there's a question that says, where do you think the patients will be shifted to once the situation stabilizes across Palestine, Egypt, or Jordan?
Yeah. So in terms of after ceasefire, hopefully soon, where do we think the patients would be shifted to if they can't be cared for in Gaza, because there's no structure, no healthcare structure to care for them? Is it Egypt, Jordan, within Palestine? Where do we think they may go?
I can start. Maybe you guys can add on to this. I know that they won't go to the West Bank or anywhere else in Palestine. I'm pretty certain of that. It's very, very rare that they would allow for that to happen. As to what other country would take them, I think this, what a lot of people are saying is that one of the objectives of this onslaught is to make Gaza unlivable. So whether or not they're going to be able to be treated there is another very, very unknown component of this. So I would probably say that just based on the what's coming out of from the Israeli side is that it would likely be on border cities in other countries. Now, which country I'm not sure and all that, but I definitely don't think that they're going to be in Palestine. And and likely not even Gaza either. So I don't know if anybody has to add.
I suspect that we don't know. You're absolutely right. Like chances of going to the West Bank will be nil. Egypt, I know the economy is in terrible shape and they've had the worst inflation in this period that they've had in many years. So I don't know if Egypt will take refugees. I don't know. I don't know if anyone has any predictions. Yeah. Okay.
And one thing just I'd like to add, when, there are a lot of countries that are not like, they have Palestinian refugees in a lot of these Middle Eastern countries that have never been given, citizenship to those countries. And, and it's the same with Egypt, why there's pressure to not also open the borders. Sure, that's going to, overburden their systems and whatnot, but there's also pressure from a political standpoint to not open, because that means if you open, then they're going to go and not be able to return. And that's what happens in a lot of these countries. It's why the Palestinians in these other countries are not given citizenship in those countries, because it's essentially saying, okay, fine, you're no longer Palestinian. And so there's a lot of, that's another kind of component of this that, as to why, I mean, sure, humanitarian aid is a different thing, but it's not just going to be, people that are, sick and injured that are coming through. And I think that that's kind of one of the objectives as well that we have to be careful about.
I would say, as a Palestinian, I would hope that the solution or the direction would be to rebuild and care for the Palestinians in their home city, on their land, basically, and get them to stay in Gaza if possible. Yeah. Okay. Any other questions? One more minutes for one last question. Any closing statements? Yes, please.
Thank you very much. My name is Abdurrahman. I think to the point that they're trying to make Gaza non-livable or unlivable, and to the bombardment that is happening all over Gaza, but particularly to the hospitals these days with the vicious attacks. I think one important problem that would arise after the war is that medical professionals that are volunteering and going to Gaza, they would probably start fearing for their lives. Like, what happens if I'm in the wrong time in Gaza and something like this happens? Would I be caught? Would I be killed? We've seen that the bombardment is not saving anyone. Medics, doctors, nurses, students, even those fleeing from the north of Gaza to the southern part of Gaza have been killed. So I think the lack of protection to the place that is supposed to be the safest place in Gaza or any other place in the world, really, is a hospital where you go for a cure, becomes the place where you are likely to be killed, and not only killed, but like even with one missile, you're likely to kill hundreds of people at once. And it's not like even a missile that will kill you before you even hear it, because of the speed of it. They're even kind of becoming more innovative and you're just using missiles and weapons that they don't even have warheads, and they're equipped with blades to just chop the people off. This is just insane. And I think as doctors, and not only as individuals, but also as hospitals, especially in places in the world where our tax dollars are being used to fund this war and to kill innocent people, I think our institutions have the moral obligation to speak up and have a stance. Again, regardless of any historic component to this, I think no one can argue that hospitals should be a safe place, should be protected. Medical professionals should be protected. patients should be protected. I just wonder, how would you view and envision the future after the war in terms of the very beautiful people like yourselves who have been volunteering in Gaza and in other parts of Palestine and other parts of the world, but particularly now we're talking about Palestine. How do you think their willingness to go again? And how do you think we can ensure that the hospitals, at least at the bare minimum, would be a safe place for people to go and shelter in? Thank you.
Thank you, Abdulrahman.
Thank
Go
you,
ahead,
Abdulrahman.
Dr. Taha.
I can tell you every single mission that we took, there is always a risk. And of course, now the risk is more clear, like because the world can see what could happen to healthcare providers. And to be honest with you, we really don't know how is the future going to look like. I think you talk about certain individual, like I am signed up, I'm ready to leave tomorrow, to be honest with you. And of course, as I mentioned earlier, all life are sacred, and the life of the people of Gaza is not less than my life. So we go with full heart, and we want to help. But of course, like each one of us have to make an informed decision, knowing the risk and benefit of every single thing we do. Even you leave your house in the morning, you make an informed decision where you're going and where you're coming. So I think there is people. I actually just joined another surgical group, and we have 10 surgeons on the other Zoom. They're already want to leave tomorrow, and we're basically trying to figure out what we need to be done. So there will be always people who are willing to risk their life, like Dr. Abu Sitta, for example.
Yeah. I don't know if people know that Dr. Abu Sitta, once the war started, he took the flight and went down to Gaza. He went to the war zone. He wanted to be in there to be able to help during the war. And today, our advisory board, the Pediatric ICU advisory board with Dr. Norman, Dr. Taha, and Dr. Suleiman, we were meeting at noon, and we're all ready to deploy. And actually, we were scheduled to go, me and Dr. Leibowitz and a team from Harvard, on the 25th of November, and still we're ready to go. If the bombing stops, if there's a ceasefire, and we can go without burdening the community, because that's also another thing. Like, we don't want them to be burdened, finding us safe places, food, etc., without burdening the community, and we could be of help, I would go.
I'm sure there are a lot of great people like yourself, but again, I think no one should be forced to
No.
take that step, right?
No one should be forced. But I can tell you, every day, I'm tired during the day, I'm about to fall asleep at night, and then I start thinking, like, why should I sleep when they're not sleeping? Why should I live when they're not living?
Why is it even an option for you to?
Absolutely.
Why
But
is it?
I think with the situation being, we can control what we can control. So if we're able to travel there, that's what I can control. I cannot control politics, and we're not politicians, but it's unfortunate. However, as you said, we speak up, institutions speak up, and hopefully we can bring some common sense and reason to the situation. Yeah. Well, thank you, everyone. Dr. Taha, Dr. Hassan, Dr. Suleiman, Dr. Norman, and Ahmed, thank you so much for coming and for sharing your experiences, sharing your wisdom. In Arabic, we call a Dr. Hakim, the wise person. And thank you for sharing your wisdom with us. Much appreciated.
Noor, if possible, to share my email with Ahmed. Ahmed, you have a family here in Oregon. You are welcome anytime. If you need anything, just call.
Boston too.
In Boston too.
Yeah.
Thank you.
Love you.
Thank you all. Thank you for joining us.